Welcome to this video. In this video we are going to discuss about the how to calculate corrected age for preterm babies. First we will understand what is meant by preterm babies. The babies born before 37 weeks is called as a preterm baby. For example, 37 to 40 weeks is considered as a full term baby. If the any infant born before 37 weeks is called as a preterm baby. For example, if the baby is born around 32 weeks or 4 weeks or either in 28 weeks is called as a preterm babies. In previous videos I have discussed about a preterm baby classification. If you want, please go and watch my previous videos. What is meant by corrected age? Why it is important? Corrected age means it helps the parents to understand if the child is developing normally or not. It actually eases the parent to track their developmental milestones by using the corrected age. If you compare with normal children with preterm babies, most of the preterm babies are going to be delay. If you calculate corrected age, then do a developmental assessment, you can find that the child is developing normally. It helps the parents to reduce their anxiety, stress, whether my child is developing normally or not, why my child is delayed. These type of questions will arise when you calculate with normal age for preterm babies. It helps to track progress of your preterm babies. Without corrected age, as previously I discussed, like if you compare with normal age children's, these preterms, most of the preterm babies are going to be delay. So parents going to worry about why my child is delay, why my child is not able to perform this activity. Like that questions will arise. If you calculate the corrected age, then do the proper developmental assessment. So most of the children are going to perform the activities or milestones to the corrected age. How to find out corrected age? For example, full term pregnancy is 37 to 40 weeks. Here I am going to give one example. Like if the present age of the child is 6 months, the child is born at 32 weeks. So how to calculate the corrected age for this infant? For this infant, see, baby is born around 32 weeks. So when to compare with full term is 40 weeks, we will consider that 40 is a full term pregnancy. The child is born 32 weeks. There is 8 weeks gap is there for this child. 8 weeks means around 2 months. Today actual age is 6 months. The corrected age is 6 months minus 2 months. The actual age of the child is 4 months. Only you have to compare milestones for 4 months old child, not with 6 months old child. Then these preterm babies are going to perform milestones at this level. Parents, why parents should use? Because it gives clarity about is their child is developing normally or not. Because oromotor development also not good for preterm babies. It gives information about how feeding and sleeping is better. Avoid comparing full-term babies. Identify real delays early. So for example, in this example we have taken like child is corrected age is 4 months. If the child is not able to perform the 4 months activities, then you have to meet any pediatrician early interventionist for support. For milestones for the preterm baby, you should calculate the corrected age. Then from corrected age only you have to track your child development. For example, neck control, rolling, sitting, standing, walking, crawling, all those things should be compared with corrected age, not with actual age for the preterm babies. Another question arises for parents, like up to what age we are going to calculate the corrected age. Corrected age calculated until up to 2 years of actual age. After that, we will not calculate as a corrected age. We will not subtract any age after 2 years, because by end of 2 years almost most of the preterm babies, they will catch up their development. If you provide little bit support, stimulation, proper activities in home, most of the preterm babies are going to catch up their development, because during this first 2 years the brain development is going to be huge rapidly. So if you provide proper assistance, proper nutrition, proper stimulation activities, proper care for the child, most of the preterm babies, they are going to attain their normal age. Then after 2 years we have to use only actual age. Here a small important information, important message for parents. Every child is unique, every preterm is unique. They are going to develop on their own pace. For a parent, you should support your child with love, stimulation, proper stimulation activities, proper interaction, home activities. Then your child is going to grow beautifully. Final message for parents: do not compare with full preterm babies to full term babies. Use corrected age, regular monitoring of developmental milestones. If any delay is there, provide proper support at correct age and do activities every day. Early support creates better future for your children. Thank you.